Hi, Jal from CNA Digital. Just want to check, what is the difference between the 900 PHPC clinics and other clinics? What are they equipped with that they are under this? And why did we choose 5 days of MC? Is there a reason behind that?
We've had the PHPC scheme for some time, as Minister has mentioned. In fact, we activated the PHPC scheme at the time when we had the haze problem, as well as doing H1N1. When GPs apply to come on the scheme, we in fact have a process of enrollment, and that includes teaching them the importance of infection control, and then training them to use the various personal protective equipment. So there's a little bit more work done in order to make sure they're better prepared to deal with patients that have infectious diseases. It's not that ordinary GPs cannot manage such conditions, but these GPs in fact have been given some additional training, additional preparation that they've done, such that in times like this, we have a ready group of doctors who are able, and their clinics who are able to stand up and then provide further support as we then manage an outbreak and a crisis. So in fact, the other GPs can manage many of these conditions, but we want them, particularly for a group of people better trained, be able to help us to sense-make when patients come to them with these symptoms, and then help us, therefore, to be able to refer the patients that we're interested in into the hospital. We looked at also the normal duration in which patients with respiratory problems recover from the illness, and the majority of people would in fact recover within 3 to 4 days. Having therefore a little bit of extra period to allow them properly to recover, setting that duration at about 5 days, allows us in fact to reduce the noise factor, because most people then with minor conditions would have recovered by then. Then it allows us also then to look and determine whether there are other patients who still are not getting better, who might be getting worse, and we then want them to come back to the GP, for the GP then to reassess, and these are the patients that in fact might also be referred into the hospital for further testing.